Welcome to NEJM This Week. I'm Dr. Lisa Johnson. This week, we present new evidence guiding coronary intervention, a molecular mechanism of inflammatory bowel disease, and gene therapy for a recessive disease. We review antidotes for anticoagulation reversal and discuss a case of hypertension in an adolescent patient. Perspectives examine cholera control, gambling-related harms, and race-based prescribing, alongside a reflection on medicine, motherhood, and what clinicians carry with them. IVUS-guided versus angiography-guided PCI in unprotected left main coronary disease by Luca Testa from the IRCCS Policlinico San Donato, Milan, Italy, and co-authors. Percutaneous coronary intervention, PCI, is increasingly used for revascularization of unprotected left main coronary artery disease. This study evaluated whether intravascular ultrasonographic IVUS guidance during PCI results in better clinical outcomes than conventional angiographic guidance alone. 806 patients with unprotected left main coronary artery disease were randomly assigned to undergo either IVUS-guided PCI or angiography-guided PCI. IVUS-guided PCI showed no additional benefit over angiography-guided PCI with respect to the incidence of stroke, myocardial infarction, any revascularization, or death from any cause at a median follow-up of 2.9 years. The percentages of patients with procedure-related and overall safety events also appeared to be similar in the two groups. There was an observed higher percentage of patients with stroke at follow-up in the IVUS-guided PCI group, 3%, than in the angiography-guided PCI group, 1%. In an editorial, Frederick Welt from the University of Utah Health, Salt Lake City, writes that treatment of the left main coronary artery with PCI is one of the riskier tasks that interventional cardiologists are asked to perform. Stent implantation in the left main coronary artery has been shown repeatedly to be a safe and effective therapy in an appropriately selected patient. But the risks of stent thrombosis and restenosis remain substantial concerns. IVUS provides a 360-degree cross-sectional picture of the artery, allows better characterization of difficult-to-visualize angiographic lesions, and improves clinical outcomes. Despite this, the results of the trial by Testa and co-authors challenge the role of IVUS in unprotected left main coronary artery PCI. During follow-up, the incidence of death, myocardial infarction, or revascularization was similar in the two groups. However, the incidence of stroke differed. The authors suggest that this result may be due to chance, but it should be addressed in future trials. At the end of the day, practice patterns will probably not change substantially with respect to the use of IVUS. However, follow-up and care after PCI are crucial in this high-risk population, regardless of whether or not IVUS is used during the procedure. Intravascular ultrasound-guided or angiography-guided complex high-risk PCI by Roberto Diletti from the Erasmus University Medical Center, Rotterdam, the Netherlands, and co-authors. Intravascular ultrasound, IVUS guidance, during PCI has been associated with increased stent optimization and a reduction in adverse events among patients with complex coronary artery lesions. But adoption of this strategy in Western countries has remained low. In this study, 2,020 patients undergoing complex PCI were randomly assigned to either IVUS-guided PCI, performed with the use of pre-specified stent optimization criteria, or angiography-guided PCI. At a median follow-up of 19 months, a strategy of routine IVUS-guided PCI was not associated with a lower risk of the primary endpoint of target vessel failure than angiography-guided PCI alone. The frequency of adverse events appeared to be similar in the two groups. Adnan Castrati from the Technische Universität München writes in an editorial that the results from the trial by Diletti and co-authors will certainly prompt new meta-analyses, which will dilute the effect of this individual trial. However, such analyses will not prevent us from drawing useful lessons from these new trial results. Most trials of intravascular imaging guidance to date have focused on improving the final PCI results achieved with stents. However, despite the use of intravascular imaging guidance, stent optimization was not observed in approximately 50% of treated coronary artery lesions. This finding may be due to insufficient optimization efforts, characteristics of the lesion that confer resistance to optimization, or the fact that not all optimization procedures are feasible after stent placement. Considering these factors, as well as the emerging role of drug-coated balloons in treating new coronary lesions, we may need to shift the focus of intravascular imaging guidance from stent optimization to lesion characterization and preparation. We have yet to fully establish how to leverage the unique information provided by intravascular imaging to guide both the indications for and the execution of PCI in a way that justifies the associated increase in procedural complexity and cost. Interleukin-10 autoantibodies and HLA-DRB1*01:03 in inflammatory bowel disease by Nima Garadaghi from the University of Oxford, United Kingdom, and co-authors. Neutralizing autoantibodies against interleukin-10 can result in a phenocopy of monogenic defects of interleukin-10 signaling in children and may be associated with inflammatory bowel disease, IBD. The allele HLA-DRB1*01:03 is the strongest genetic risk factor for ulcerative colitis. These investigators assessed neutralizing interleukin-10 autoantibodies in serum samples obtained from 4,909 patients with IBD and from 1,006 persons without IBD, controls. Interleukin-10 neutralizing autoantibodies were detected in 3.5% of patients with IBD and in none of the controls, thus defining an immunologically distinct subgroup. Neutralizing interleukin-10 autoantibodies were also strongly associated with the HLA-DRB1*01:03 allele. In a Science Behind the Study editorial, Paul Bastard and Jean-Laurent Casanova from the Necker Hospital for Sick Children, Paris, write that the discovery by Garadaghi and co-authors supports a molecular mechanism of IBD that incorporates the previously established association with an HLA risk allele. It is the first established common molecular mechanism of IBD. The study by Garadaghi et al. Neatly illustrates the power of patient-based basic research. That is, research that aims to shed light on conditions at the individual level, because health and disease do not operate biologically at the population level. Basic research aims to discover the biologic causes and mechanisms of disease in ways that are biologically sound and clinically actionable. The discovery of IBD-causing autoantibodies against interleukin-10 in a significant proportion of patients with IBD is reminiscent of the finding that autoantibodies against type 1 interferon can be a determinant of how severe a viral disease can be in a given patient. Following this mechanistic thread, the discovery of very rare patients with inborn errors of interleukin-10 led to the discovery of rare pediatric patients with interleukin-10 autoantibodies, which in turn led to the discovery that 3.5% of adults with IBD carry these autoantibodies. Perhaps other classes of disease, such as cancer and age-associated conditions, should be studied from the angle of inborn errors discovered in childhood and the possibility that autoimmune phenocopies may occur in adults. Subretinal gene therapy for X-linked retinoschisis by Litsong Liang from the West China Hospital, Chengdu, China, and co-authors. X-linked retinoschisis is a recessive disease characterized by progressive macular degeneration and vision loss due to pathogenic variation in the RS1 gene. In this study, a single subretinal dose of an AAV8 vector containing human RS1 complementary DNA, cDNA, was injected into one eye of 12 pediatric patients who had X-linked retinoschisis. The primary endpoint was safety during the 52-week period after injection. The investigators observed 56 adverse events of grade 1 or 2, but no adverse events of grade 3 or higher, or ocular inflammation during the follow-up period. A secondary endpoint of the mean increase at week 52 in the best-corrected visual acuity was 10.8 letters among the treated eyes and 2.4 letters among the untreated eyes. Improvement in retinal structure was observed. Further clinical testing of this treatment is warranted.
Medicine is driven by the latest innovations. So why do some critical diagnostic tests rely on old racist ideas?
I was like, do black people have more muscles than white people? I don't think that's the case.
We had a reason to include race, but we thought it would make the equation more accurate.
It's scary because everything you've been doing is wrong.
To hear all episodes of The Race Equation from the New England Journal of Medicine, subscribe to Intention to Treat.
Antidotes for Anticoagulation Reversal. A review article by Bianca Racca from Leuven University, Bari, Italy, and Hugo Tenketa from the Maastricht University Medical Center, the Netherlands. The global rise in anticoagulant use has increased the number of major bleeding events that warrant timely and effective pharmacologic reversal. Reversal strategies should be informed by the pharmacodynamic and pharmacokinetic features of the anticoagulant and antidote used, as well as regulatory indications, quality of evidence, patient-specific factors, and availability of treatment options. For example, protamine sulfate neutralizes unfractionated heparin, whereas no specific antidotes exist for low molecular weight heparins or fondaparinux. 4-factor prothrombin complex concentrates effectively reverse vitamin K antagonists. Idarucizumab specifically reverses dabigatran, although delayed dabigatran rebound can occur. Andexanet alpha targets direct oral factor Xa inhibitors, but uncertainties regarding the efficacy-safety balance, monitoring, rebound, perioperative use, and cost have prompted off-label use of 4-factor prothrombin complex concentrates, for which stronger evidence is needed. Key challenges remain, including determination of appropriate dosing, standardization and validation of laboratory monitoring, mitigation of thrombotic risk, and development of guidelines for perioperative treatment. Emerging agents aim to broaden targets and improve safety. Building high-quality evidence remains essential to advancing global, patient-centered anticoagulant and hemostatic care. A 14-year-old girl with hypertension. A case record of the Massachusetts General Hospital by Rachel Osborne and colleagues. A 14-year-old girl was admitted with severe hypertension after 10 days of worsening nausea, vomiting, headaches, dizziness, and weight loss. For months, she had experienced intermittent chest pain, palpitations, tremors, and daily headaches that had become progressively more frequent. On examination, her blood pressure was as high as 180/116 millimeters mercury, and laboratory studies showed hypokalemia and markedly elevated inflammatory markers. During hospitalization, she developed blurry vision and a transient episode of unresponsiveness in the setting of hypertensive emergency. Imaging revealed severe stenosis of the left renal artery with atrophy of the left kidney, along with inflammatory thickening and narrowing of the aorta and major vessels. She was diagnosed with Takayasu arteritis, causing renovascular hypertension. Treatment included intensive blood pressure control, glucocorticoids, methotrexate, and infliximab. However, despite medical therapy, renal artery stenosis and poor kidney perfusion persisted. Balloon angioplasty was performed, after which her hypertension resolved. Global Cholera Control Efforts, Progress and Remaining Challenges. A perspective by Edward Ryan from Massachusetts General Hospital, Boston, and co-authors. The current cholera pandemic, the seventh in recorded history, began 65 years ago in 1961, and there is little evidence that it will end anytime soon. The number of new cases and the magnitude of outbreaks continue to increase. Cholera is currently endemic in nearly 50 countries, causing millions of cases and tens of thousands of deaths each year. The disease primarily affects the world's poorest people, especially those lacking safe water and adequate sanitation and hygiene facilities. Long-term control of cholera and other diarrheal diseases can only be achieved through water, sanitation, and hygiene. Yet at least 2 billion people lack access to safely managed drinking water. Deployment of an effective cholera vaccine could contribute substantially to response and prevention. Annual global production capacity of the oral cholera vaccine has increased to more than 65 million in 2025, and already in 2026, more than 250 million doses have been shipped to 37 countries, averting an estimated 8 million cholera cases and more than 100,000 deaths. While incorporation of the oral cholera vaccine into global cholera control strategies has been transformative, it has not been shown to be particularly effective in children under 5 years of age. The WHO estimates that at least 1/3 of global cholera cases and deaths occur in children 5 years of age or younger. Whatever the path of global cholera control efforts, better cholera vaccines are needed, including ones that are highly effective in young children and have a long duration of protection. Detecting gambling-related problems, an opportunity to reduce suicidality. A perspective by Debbie LaPlante and Heather Gray from Cambridge Health Alliance, Malden, Massachusetts. Gambling expansion is a pressing issue for the healthcare system. In the United States, several factors: the legalization of sports betting, the ubiquity of gambling-related marketing, advertising, and celebrity endorsements, and the rise of gambling-adjacent activities, such as cryptocurrency trading, betting in prediction markets, and day trading, have created a culture in which there are increasing opportunities for engaging in risky behavior. For some people, greater availability of gambling activities will lead to increases in gambling, and in turn to gambling-related problems, ranging from subclinical harm to clinically diagnosed gambling disorder. Associated problems could include financial distress, damaged relationships, and poor health outcomes. In 2025, the American Gaming Association, an industry trade group, estimated that 57% of U.S. adults engaged in legal gambling activities during the previous year. As legal gambling activities become increasingly available in the United States and are widely promoted, there is an urgent need for the healthcare system to respond appropriately. Work is needed to ensure that the healthcare workforce is prepared to help patients understand and mitigate the harms associated with gambling and gambling-adjacent activities. Incorporating screening for problem gambling into primary care could be a natural first step in expanding detection and treatment. Prescription without precision. Dangers of dosing on the basis of race as biology. A perspective by Hersimer Ahuja from the University of Pittsburgh School of Medicine. Despite that racial and ethnic categories are poor proxies for genetic diversity, race continues to be used to guide pharmaceutical use. Multiple drug labels approved by the U.S. Food and Drug Administration incorporate broad categories of race, ethnicity, or ancestry into their prescribing recommendations, even though it is now possible to rely on more precise and validated genetic, biochemical, or clinical markers. As a result, clinicians may be encouraged to base treatment decisions on imprecise social classifications. When race is used as a proxy for more specific determinants of drug metabolism or response, patients may be exposed to ineffectively low or dangerously high medication doses. Some FDA-approved prescribing guidelines recommend that patients from particular racial or ethnic groups undergo genetic testing before starting certain therapies, whereas others advise different dosing strategies on the basis of racial or ethnic classification. These recommendations are motivated by important goals: reducing adverse drug reactions and improving patient safety. Yet it remains unclear whether the use of broad racial categories meaningfully advances those goals. Whether guidelines grounded in socially defined race categories can reliably benefit individual patients warrants careful scrutiny. Continued reliance on crude racial and ethnic categories in prescribing advice is difficult to reconcile with the principles of evidence-based medicine. Carrier. A perspective by Sarah Calvert from the University of South Carolina School of Medicine, Greenville. The chief orthopedic surgery resident was performing a hip replacement, and as a medical student, Dr. Calvert was trailing her on rounds. The resident emanated capability. Her 9th-month bump was obscured by her gown, and she continued operating while in labor. Dr. Calvert was witnessing great strength, she believed, and then carried this image with her into her own residency. Eventually, she is a third-year resident carrying her own little girl, but her bundle of joy feels like a burden. Dr. Calvert presses on, acting the role she'd seen performed as a student by the orthopedic surgery resident. Dr. Calvert takes pride in her sameness. With what she reassures herself is strength, she makes no allowances for her body or heart. She lets her joy be squashed beneath the weight of clinical duties. Then, holding her baby, Dr. Calvert paces laps around the house. The movement soothes them both. But Dr. Calvert is restless, and undercurrents of shame swirl around her motherhood. Strained in both mothering and medicine, Dr. Calvert feels she is performing both roles poorly. Early into a second pregnancy, she feels vaguely unwell. There is a heaviness deep in her that she chooses to call butterflies, just due to the typical unease of a new rotation. But 2 patients into pre-rounds, Dr. Calvert registers a warmth running down her thighs. After the miscarriage, Dr. Calvert tells herself, 1 in 5 pregnancies ends in miscarriage. This is nothing extraordinary. Carry on with the ordinary. She neatly folds and tucks the grief into a white coat pocket. Soon afterwards, her daughter is sick and the daycare calls. Dr. Calvert gets her daughter from the daycare and brings her to work for her last 2 telemedicine consults of the day. She finds herself watching her daughter in wonder. Her daughter's perfectly formed fist, arm rolls, enormous eyes. Many of us in medicine have carried on through a great deal. We look around and others are carrying on. Dr. Calvert had carried these things: expectations, shame, and a distorted image of strength. Dr. Calvert picks up her daughter and carries her home. In our Images in Clinical Medicine, an 11-year-old girl presented with a 1-month history of right thigh pain that worsened at night. Radiographs of the knee revealed a metaphyseal osteoblastic lesion with a sunburst appearance, a finding that is seen in aggressive bone lesions. A diagnosis of high-grade osteosarcoma was made. In another image, a 58-year-old woman with diabetes, complicated by diabetic retinopathy, presented for an annual eye examination. Stereofundus photographs showed neovascularization of the disc extending out from the retinal plane. A diagnosis of active proliferative diabetic retinopathy in the right eye was made. Prompt treatment to regress the neovascularization in this condition is indicated because the delicate, newly formed vessels may lead to tractional retinal detachment or hemorrhage. Read more from our issue at NEJM.org. Tell us what you think about our podcast. Any comments or suggestions may be sent to audio@nejm.org. Thank you for listening.